This program is brought to you by Emory University.
Thank you so much. I met some of you yesterday. Thank you for having me, and thank you for all coming and packing this room on this cold morning. As Lisa said, I'm going to talk about an intervention that we did at UW-Madison. I gave the punchline for this intervention yesterday, but I'll walk you through this in more detail. So this is a cluster randomized control study of an educational intervention in STEM departments. No, it's not that I can't spell, it's that we add an M for medicine. So science, technology, engineering, mathematics, and medicine, STEM. And I'd just like to acknowledge the people who worked with me on this project. There were a lot of moving parts in this study. And the premise of the work is that the mere existence of cultural stereotypes, whether you believe them or not, whether you endorse the content of them, the mere fact that cultural stereotypes of groups of people exist lead to usually unintentional, often unwitting bias in our judgment and decision making about individuals who may be in those stereotyped groups. And the popular term for these now are the implicit biases. Depending on what stream of research you look at, they have different names, but implicit bias is kind of the popular term now. And we believe that these implicit biases occur as habits of mind, habits. And importantly, these habits of mind occur even in people who personally disavow prejudice, who personally are sincerely and honestly committed to egalitarian goals and meritocratic principles, that we all have these implicit biases simply from living in this society. Really, it's paining me to see this empty chair because somebody's there. With all the people crowd, yes, please. Somebody needs to take that chair. Everybody's bunched around here. It has a back, for those of you with back problems. But anyway, we further reason, and because I'm a physician and I see many of you are in the health sciences, we reason that if these implicit biases occur as habits, they are remediable. We have decades of research in the health sciences now showing how people can change habitual behaviors. So I just want to acknowledge the R01 that funded this, and you'll notice that it's research on causal factors and interventions that promote and support the careers of women in biomedical behavioral sciences. So our focus had to be on gender bias. Whenever possible, we would use examples beyond a gender context, a race context, or others, but we had to show fidelity to our funding organization. The RFA focused on gender bias. So, thinking about gender, we can all name cultural stereotypes that exist about men and women, and talked about this in the lecture yesterday. So again, even if you don't believe them, these stereotypes are pervasive. And if I said, well, what would be typical stereotypes about men? You say, well, okay, men, let's see, they're strong and courageous and decisive, competitive, ambitious, independent, willing to take risks. And these are generally called agentic. These are agentic traits and behavior. They're action-oriented, and they're much more stereotypically associated with men than women. Similarly, if I said, well, what are stereotypes that exist in society about women, even if you don't believe them, even though we know gender is not actually binary, it's sort of flexible, but still, if I said, what are social stereotypes about women? You could name them. You could say, well, let's see, in the abstract, women are soft and kind and nurturing and gentle, supportive, sympathetic. There could be some negative ones too, whiny, emotional. But nevertheless, and the fact that we laugh, humor depends on shared knowledge. So for men, if I said doesn't stop and ask for directions, right, you would laugh because is that not a well-known culture stuff? Even though, of course, we all know men who stop for directions, and we probably all know women who don't. Nevertheless, it is an assumption that men are more likely not to ask for directions. Although, as I say, there's always a little truth in the content of the stereotype. But it does not apply to all men. So how might just the mere existence of these stereotypes and the assumptions, the group assumptions that might come along with them, influence the way we make decisions that could be relevant to the advancement of women in academic science and medicine? Well, we can look at NIH funding, right? That's a very important activity to be successful at if you're going to move along an academic career. And we see by gender, and NIH puts this right on their website, actually very little difference in the success rates of men and women who apply for NIH grants. But when there's a difference, it is exactly where you would predict the difference would be by how these stereotypes would play out. So women are less successful, or men are more likely to hold high prestige grants, NIH Pioneer Awards, big budget grants, program projects, and although for type 1, that is going in for a new R01 or K awards, men and women are equally successful, women have been 2 to 8 percentage points less likely to be funded than men when they come back in for their type 2 renewal, when they come in for their R01 renewal. And again, it's on the NIH website. 1998, when they first started recording data, up to 2013, you can just go to NIH.gov and look, and women are consistently below men in success rate for type 2. And again, it's exactly where you would predict, because here you have both leader and scientist, both of which are more likely to be associated with agentic traits and hence more strongly associated with men. And there are dozens and dozens of studies, experimental, rigorous studies over the last 30 years that use what's called a Goldberg design and consistently find essentially no change over 30 years. That if you take some piece of work, could be a manuscript, a resume, an application, and you randomly assign a male or female gendered name. That's the Goldberg design, because Goldberg did the first study with it. And there's a consistent finding that both men and women will rate the quality of the work lower if they think it was done by a woman. Unintentionally rate the quality of the work lower. And 2 years ago, Joe Handelsman's lab put this Goldberg design right in the middle of science, and this study got so much publicity. Most of you may have heard of it. It was written up in the New York Times. It made its way into Sheryl Sandberg's lead-in book. It was an amazing study in terms of the fact that it used really methods that have been used for years. A study design had been used for years, but it brought it in the middle of science, because people could previously, these are done in undergraduates, they weren't done in science. We're scientists, we're objective, we wouldn't do that. So Joe said, well, let's just see. So she took a resume of a student applying for a lab manager position, Goldberg design, same application, randomly assigned Jennifer or John, and she sent it to male and female science faculty at different institutions and different departments around the country, and found exactly what one would predict, that male and female science faculty, with no difference, rated the male applicant as more competent, more hireable, more deserving of mentorship, worth a higher salary than the identically credentialed Jennifer, who was nevertheless assumed to be more likable. With the exact same data presented, the evaluators were evaluating that data through the lens of the gender stereotypes that exist in society. So again, we focus on gender because of the R01, but let me just give you some examples in a race context too, to show you how any stereotyped group, but race and gender particularly in our society, are important. So implicit bias predicts things like awkward body language in a conversation between a white student and a black student versus a white student and a white student. And again, these are very rigorous experimental studies. Awkward body language between a white student and a black experimenter versus a white experimenter. Interpretation of friendliness in facial expression. More negative evaluation of a black versus a white individual's ambiguous actions. And consequentially, inadequate prescription of opioid analgesics in identical clinical vignettes of Black versus white patients in pain, and failure to follow treatment guidelines in prescribing thrombolytic therapy in identical clinical vignettes of a Black versus a white patient with acute myocardial infarction. So this is life-saving therapy.
Can I ask a quick question?
Yes, please.
Are you willing to make these slides available to us?
So the data's not published yet. But I did, I put a couple of handouts. We described the workshop in great detail. That's been published, and the early evaluation. I put a couple, it's in the Journal of Diversity in Higher Education, and actually all the materials from the workshop are there based, you can go to the supplement, it gives the case studies we use, it gives more detail than I'll be presenting today. But academic medicine is funny about the results.
I totally
You've all been there, right?
The question is just how many notes do I have to take?
Yeah. Well, I guess I could bleep out the data slides at the end, and I can send you those. So email me, and I can send you everything.
Thank you.
And I did pass out a bibliography yesterday, and I have another copy if you want to make additional copies of that. And that has all the references that you'll see in the slide, so you don't have to write the references down.
Thank you.
Oops, yeah, did that. So back to thinking about implicit bias as a habit. One thing we know about habits is it takes more than good intentions to break a habit, because the Surgeon General's report came out on smoking in 1964, and some people are still smoking. So good intentions not enough. If it were, we'd all be exercising 30 minutes a day, and we'd all be driving the speed limit, and bad habits are hard to break. So awareness is important. But breaking a habit is a multi-step process, and there's much research on this from psychology, from education, from multiple different streams of research. And basically, if you want to engage in an intentional behavioral change that becomes habitual, you need to be motivated to make that change. You have to have self-efficacy. That is, you have to be confident that you can engage in a new behavior. And you have to have positive outcome expectations. That is, if you're going to go to the trouble to engage in a new behavior, you must really believe there's going to be some benefit to you. And you have to deliberately practice the new behavior until it becomes habitual. So our study, Breaking the Bias Habit in STEM Faculty, was a cluster randomized design. The cluster is the department level. And we identified 92 departments or divisions that function like departments. So the subspecialties of internal medicine, we each treat it as a department. Our School of Pharmacy has 4 divisions which aren't actually departments but function like departments. So we said department or department-like units, but then we called them departments once they were identified. And we matched them into 46 pairs by the overall focus of their research. We call these divisions, so physical science, social science, arts and humanities, biological sciences, the school or college they were in, and the size of the department. And then we randomly allocated them to intervention, the experimental department group, or waitlist control. And we were blinded to the assignment. We went around and met with all 92 departments to let them know that at some time over the next 2 or 3 years, their department would be invited to participate in this NIH-funded workshop, emphasize that. And we didn't know when it would happen, and that they would be invited, because it was taking so long, they might be invited to take little surveys throughout the time course just to keep our instruments validated, just to because we knew the control group would get the questionnaires not associated with an intervention. So we told them in advance, because it's going to take so long, you might be getting little questionnaires that aren't, affiliated with your workshop, so look out for those too, because we were quite worried about the response rate in the control departments. And then the intervention was a bias literacy workshop, and we spent a year developing that. We had 2.5 hours, it was a 2.5-hour workshop, to take individuals and make them change their behavior from thenceforth. So we squeezed evidence from continuing medical education, where it's sort of a similar paradigm. We said, well, what do they do in continuing medical education to make doctors change their prescribing habits? Oh, written commitment to change, we'll put that in. So we had a written commitment to action. We had case studies. We gave information and had them immediately apply it, pulling from medical education and science education. I collaborate with a sociolinguist, and she videotaped. We did 2 pilots. Actually, we did 3 pilots because University of Virginia invited us to do a presentation. I said, can we use you as our pilot? So we did 3 pilots, and the 2 in Madison were videotaped, and then she and her graduate students looked at the videotape to see where the participants, the pilot departments, were engaging in, affiliative behavior, looking at us, listening, or disaffiliative behavior, shaking their feet, doing their iPhones. And because of that, we realized we had to put in a small break because feet were shuffling after an hour. So we really tried, and then we did an iterative process. Our second pilot, was informed by our first. So we really tried as much as possible to take an evidence-based approach to this workshop. And then we launched it, and it took 17 months to work our way through the 46 departments. We standardized it as much as possible. There were 3 presenters that traded off, and I myself had to do, I think, 3 workshops myself, because just of scheduling. But we thought that was pretty standard, and we practiced doing the same script every time. And then the measures, we did an implicit association test. Many of you may be familiar with that. I mentioned it yesterday. This is a test developed by Tony Greenwald and colleagues. If you are interested in measuring your own implicit bias on a number of areas, you can just Google IAT, and it'll take you to, there's a link for Harvard Project Implicit, and it works by having you match as quickly as you can. It's a dual categorization task. You match stereotype congruent words or pictures and stereotype incongruent words and pictures, and then it takes a difference in the reaction time between the 2 and tells you the strength of your implicit bias. So we did one for gender and leadership that was developed by Das Gupta. It puts up male or female gendered names, and you have to match them with words associated with leader role or supporter role. And then we developed questionnaires from focus groups and from the literature, and we piloted these and ran factor analyses on them, and measured motivation, self-efficacy, positive outcome expectations, all the things I mentioned, as well as self-reported gender equity action. And then separately, we have this study of faculty work life that started under our advanced grant, and we now have 4 waves of it, and we timed it so that study went out before we did any workshops, and then after all the experimental departments had had their workshop, but before the control groups were invited to have a workshop. So are there any questions about that? Okay. And so then just to show you, again, our departments, we met with all 90, actually the Department of Anthropology did not meet with us, they got a handout, but everybody else let us into their faculty meeting to tell them what we were gonna do. And then, again, we paired them, and there was no problem. Once they were allocated, we were able to follow every department. For 3 departments, though, nobody came, but we did an intention tree analysis. We included them anyway. And 75% of the time, I think it was, or 72%, the chair attended as well. And so then we culled data from this survey of faculty work life that was given before and after our intervention. Oh yeah, I guess some of you probably can't see. Oh, maybe you can see this. Can you see that one? Oh, I won't stand in front of it. Sorry about that. So the workshop format, we gave an introduction, making the case with evidence of the economic issues associated with the importance of advancing women. Then we had immediately the participants engage in a paired activity, so active learning. We had them think about how they would define gender equity in an academic setting. And then, we came back was think, pair, share, just like you do in your classrooms. And they came back and we had them talk about how they define gender equity, and then we gave a little more data, and then we had them pair again to talk about how gender equity in their department or field would benefit the field. And then we moved on to 3 modules, talking about the origin of bias as a habit. The second one is sort of the bias literacy one, where we picked certain concepts to show them how bias might look in an academic setting. Then we gave them personal bias reducing strategies they could practice, and then again we summarized with this commitment to action, a written commitment to action.
Did you use case studies for the literacy? How did you do that?
And,
Okay.
and you'll, if you want to see the case studies, the supplement for the paper, I just brought a few copies, but it's the Journal of Diversity in Higher Education.
Okay, thank you.
And all of the cases, everything we did, we had previously piloted and responded to faculty feedback. So again, Module 1, Origins of Bias, we start with object perception and demonstrated how habits of mind can be subject to error and fail our intention. So again, we led the participants conceptually from object perception to social perception. Then we discussed the IAT. And so I'm going to show you a little bit about how we showed the participants that habits of mind can be subject to error. So this is just available on the internet. You've probably seen it. And we would say to the participants, do these tabletops appear to be the same size and shape? Do they appear to be the same size and shape to any of you? No. And yet they are the same size and shape. And I will just highlight this one and move it over and flip it around. And I'm sure it is still impossible for you to believe that those are the same size and shape. And so, lest you think I'm engaged in some sleight of computer, we actually had the very high-tech overheads that we would pass around. So there's 2 in each one, and I invite you to just pass them around. You can take them out and do the same thing I did, which is just flipping the one on top of the other until you have convinced yourself that indeed these tabletops are the same size. But you have a lifetime of experience interpreting these tabletops in a 3-dimensional environment, where the orange one really would sort of go back like that, and the red one would look like that. And that habit of mind actually makes it impossible for you to interpret these tabletops in a 2-dimensional portrayal. So habits of mind subject to error. Here's another one, just while you're passing that around. I don't have a handout for this, but so now this one's by Edward Adelson. And he writes, surely you can see that the shades of gray in squares A and B on the checkerboard are identical. So on the checkerboard, oh here, I'm standing in front of this, but you see A and B. Do they look to be the same shade on the checkerboard? No, they don't at all, right? B looks lighter than A. But you see A and B on the side there, and they do appear to be the same, right? Okay, but I'm just going to move it over, and you will not believe this. But in fact, and I'll do it every way I possibly can. But those are actually the same size, or the same shade. And the reason you can't see that they're the same shade is, again, you have a lifetime of experience interpreting real illumination of light coming behind a green cylinder reflecting on a checkerboard of different shades of gray, and that habit of mind actually makes it impossible for you to interpret this. I hope there's another tear. Okay, good. There's another one. So then, after we've made the case that habits of mind can be subject to error, we go on to make the case that habits of mind can fail our intentions. And we use the Stroop color naming task, something that all of you are probably familiar with. Anybody who's taken introductory psychology has probably taken this. And so this one involves a little audience participation, and I'll invite you to participate also. So I'm going to show a series of words. I want you to ignore the content of the word and call out the color of ink in which the word is written as quickly as you can. Ignore the content of the word. Call out the color of ink as quickly as you can. Ready? Go.
Red, black, brown, green, yellow, blue.
Okay, great. So trivially easy, right? Very excellent. You're as good as the people at UW-Madison. Okay, so now I'm going to give you the exact same instruction. I want you to ignore the content of the word and call out as quickly as you can the color of ink in which the word is written. Okay, ready? Go.
Blue, green, red, yellow, black, brown.
Okay, good. I think you could feel yourself going slower, right? Because your intent was to ignore the content of the word, but at this point in your life, you can't not read English. You know, and often it serves you well. You know, you're driving around, you see, you know, road out, bridge out. It's good that you can read that so fast. But in this case, the fact that you can't not read those words actually fails your conscious intention, even if you may be unaware of it. So in the workshop, we use these to show people in a very neutral way how habits of mind can be subject to error and fail our intention. And then we talk about the implicit association test. So everybody has been given that implicit association test within 3 days before the workshop, and most of them have taken it. So we talk about the IAT. We ask them, you know, what was their experience with it. Most people immediately assail the methodology. They say, well, you know, it gave me the right one first, it gave me the left one first. And we acknowledge that that's been tested and doesn't seem to make any difference. Handedness doesn't make any difference. Some people say, oh, I felt so guilty. And we're like, that's the point. You know, you score on that in a way that makes you feel guilty because it doesn't align with your beliefs. And then we kind of go through the logic of the IAT. So again, this is the little timed computer task I was talking about. It measures the strength of association between categories such as male and female and attributes, in our case, such as leader and supporter roles. And then again, the strength of association is reflected in the time in milliseconds it takes to respond to the stimuli on a computer screen while trying to respond as rapidly as possible. So it bypasses your conscious intent. And then again, there are two trial types, as I mentioned. There's the stereotype congruent trial and the stereotype incongruent trial. And it looks kind of like this. In ours, you know, you saw a leader word and a male name, a supporter word, or a female name, and you had to match it, and then you were given the stereotype incongruent leader or female name, supporter or male name. And then it calculates, the test itself subtracts the time, accounting for errors and some other strategies that Project Implicit does. We collaborate with Project Implicit for our data. And then it subtracts the time in milliseconds from the incongruent trials and the congruent trials, and that's the IAT effect. And the larger the difference, the greater the bias. So science, just to show you how it works, Nozick has culled, he's one of the PIs of Project Implicit at University of Virginia now, and he's culled data from this website and published a number of things off it. This was a few years ago, looking at the IAT for gender and science, and this one works by putting up male and female names, and then words associated with science like biochemistry, physics, or words associated with the liberal arts like history and English. And 70% of both men and women who take this test more strongly link science with male names and female names with liberal arts. So then, are there any questions about that? Okay, then we move to Module 2. So that's sort of the bias literacy module. And we've chosen 6 bias constructs or bias concepts, whatever you want to call them, to help people name them, help people recognize in their own environment when implicit bias might be active. So we talk about expectancy bias, how, you know, anytime you have a social group that shares something in common, stereotypes emerge and expectancy bias happens. It just does. So if you hear I'm from Wisconsin, you're going to expect that I like the Green Bay Packers or cheese. And you just, that comes with it. That's the content of the stereotype, and that's just the way the human mind works. And then we move that sort of neutral expectancy bias more into gender and talk about how with gender, these expectancy biases, you expect a woman to be communal, you expect a man to be agentic, and how there's also this prescriptive edge to it, such that you expect a woman to be communal and not too agentic, and if she is too agentic, she can suffer social reprisal. And for men too, if they behave too communally, they may suffer social reprisals. And then we move to occupational role congruity, showing how these gendered assumptions can favor men in evaluation for roles where it's assumed that agentic traits are needed. These are most of the roles in science and medicine. And for each one of these, we illustrate with a real-world example or an experimental study. So for example, for the prescriptive gender norms, we illustrate that one with a study that shows how these can work against men. And it's a study by Smith. It's a Goldberg design. Identically credentialed applicants for a high prestige position, randomly assigned a male or female gendered name, factorial design, second level of randomization. The resume either does or does not contain an employment gap. And the evaluators are actually members of an professional HR organization. A lot of these studies are done with undergraduates. This was done with professionals in a human resource organization. And they were asked to rate the applicants on a host of employment-related variables, and then the evaluators were given the opportunity to write in their thoughts about the applicants, and they did a content analysis of that text. And the employment gap only disadvantaged the male applicant. And what kinds of things do you think people wrote in about the female applicant who had an employment gap? Yeah, there was nothing about family. They assumed it was related to children, to the point that one person wrote in she'd be a great hire. She's clearly done having children. But you fill in with your stereotyped assumptions when given the opportunity. What kinds of things do you think they wrote about the man with an employment gap?
He was in rehab.
That's exactly right. Drug and alcohol rehab, and some were even more creative. Prison, right? Because an employment gap is actually a gender norm violation for men who are assumed to be the breadwinner, the linearly employed person. So an employment gap can actually trigger a violation of social norms for men. So we particularly chose that so people could see that these stereotypes can constrain the opportunities for men and women. It's just that in talking about careers in science and medicine, women tend to be more disadvantaged. If you were talking about careers in childcare, men would be more disadvantaged. And then we talk about reconstructing credentials, showing studies that show how the exact same credential can be valued differently depending on who has it. We talk about stereotype priming, and here we use the example of the NIH Director's Pioneer Award, which in the first round was full of semantic gender priming that would be predicted from experiments to favor male applicants. So the announcement of the award said NIH wants to fund scientists willing to engage in high-risk research. Risk was everywhere. And if you look at the BEM sex role inventory, willing to take risks remains highly valenced male. So anytime you say we're looking for people willing to take risks, who have the potential to be scientific leaders, basically what you're saying without using those words is we're looking for men. And in fact, there were no women in the first round. And then the wording was changed. NIH no longer was looking for high risk research. It was looking for innovative research with the potential to improve human health. Much more website originally was www.highrisk.nih.gov. It was changed www.roadmap.nih.gov. And anyway, since 2005, which was the second round, women have been represented, probably similar to their numbers in the applicant pool. If you look at R01 holders and figure that might be the applicant pool. And then we talk about stereotype threat, which is also a type of priming, but this is the phenomenon described by Claude Steele at Stanford, whereby if you happen to be a member of a group that has a negative performance stereotype, you can actually underperform relative to your abilities if somehow being a member of that group is made salient, sort of the threat of confirming the stereotype. And we use examples to show how that can work. And again, we apply the cases in a reader's theater. So we have audience participation. Everybody in their folders has copies of the cases, and they have roles, and we ask faculty to volunteer to read the roles, so it gets them involved, and then we break them up into small groups to discuss the case. And we have two cases, one after the first three constructs and one after the second three constructs, and we have a little break in between. And then module 3 is where we give people personal bias reducing strategies that they can practice. And we even pass these out, I don't know if I had enough, but we give them in their folders to take home. We say, this is the bookmark you should put up on your bulletin board. On one side it has the strategies to break the bias habit. On the other side it has the bias literacy terms that we've rearranged into an acronym for PERSIST, because you have to persist to break the bias habit. So we tell them, and again we illustrate these with real experiments to show how they do reduce bias. So one is stereotype replacement, and this is simply practicing consciously replacing a stereotype. If you notice yourself having stereotyped assumptions about a group, or if you recognize stereotypic portrayal, which happens all around us on commercials, I mean everywhere there's stereotypes being portrayed, name it, recognize it, say, oh my God, that's a gender stereotype, and then replace it with real data. So if you see a stereotype that women can't be good at math, I'll say, oh God, that old stereotype. We know, research shows, actually research from my own institution, Janet Mertz, that once you control for the number of math courses taken, there's essentially no difference. And I mean, there's some argument that maybe there's a difference way, way, way out on the tail of that distribution, but for the vast majority of us, even if there is a difference on that tail, it's not gonna matter. So, but even the tail is debated, but you can replace it with real data that no difference. Counter stereotype imaging, this comes from the work of Irene Blair. So particularly before an evaluative task, if you make yourself imagine a positive counter stereotype exemplar, so a woman leader in great detail, someone you know or someone in the abstract, or an African American scientist, or some positive exemplar, that has actually been shown to reduce the influence of stereotypes in subsequent judgment. Individuating simply means getting more information, again, particularly in an evaluative setting. So if you're evaluating applicants, Madeline Heileman, who's done a lot of work in this area, shows if you give skimpy information when a male or female applicant with the identical application is applying for a male-typed position, your mind will fill in that the man is more competent. But if you have detailed information about job-relevant competence, task competence will trump gender assumptions. So if you are in a situation where you're getting applicants, be sure to give opportunity for all applicants to provide detailed, specific, job-relevant competence. If you use abstract words, it's an opportunity for assumptions to fill in. So if you say, we want a leader, well, what is that? be specific. We want somebody who has managed a budget of at least XYZ. We want somebody who's mentored at least 4 scientists. We want somebody who's held an R01. If you're very specific in what you mean by a leader, it actually prevents your mind from filling in with assumptions, just like that employment gap. You know, if it had said, you know, took a sabbatical at Google, then that would prevent you from thinking that the person had been in prison. And then perspective taking has been shown to reduce implicit bias. Adam Galinsky and others have done a lot of work in this area, and that is just putting yourselves in the shoes, often in the first person, of a member of whatever group. You know, think what it must be like to be the first person in your family to go to college. Think what it must be like to always have your credentials questioned. You know, think what it must be like to be at a professional meeting and be hit on by some guy. I mean, you know, you can just go on, and it actually can reduce bias. Increasing opportunities for contact. This has been known for a long time, and it has to be increased opportunities for contact of exemplars of leaders, in this case, women leaders. So it can't just be increased opportunity for contact with women, because if it's increased contact with women consistently in subordinate positions, it actually reinforces the stereotype. It has to be women leaders, you know, make opportunities, invite the women professors in for discussion, ask them what their vision for the institution is, ask them to develop a white paper, you know, expose yourself to counter-stereotype exemplars. And then we also, again, illustrating these with a randomized controlled experiment, 2 strategies that don't work because intuitively they seem like they would work, and they're sort of the go-to strategies for people, but they backfire. So one is stereotype suppression. That is, you know, I don't see color, I don't see gender, I treat everyone the same. Now that would seem like it'd be a good thing, but actually that approach increases the likelihood that stereotypes will bias your judgments. It's actually much better to take a sort of, diversity exists, I recognize it, I value it, it's good for our institution. That kind of mindset actually is much less likely to allow stereotypes to influence judgment. And then having too strong a personal belief in one's objectivity, and we really emphasize this one and show an experiment to show how it works, because we're dealing in science, and you know, people spend their lives thinking they're objective and searching for the truth. So to tell them that they may not be objective, you know, they're horrified. But we show them how people who say they are the most objective consistently give the most biased evaluation. And we encourage people to entertain the humbling possibility that they may actually be contributing to the perpetuation of inequities in science. Any questions about that? All right. So then just to show you some of the results of the study. Overall, it ranged from 0 to 94%, but overall we had a 31% attendance. The size of the departments was the same in the intervention and control. Again, the department chair attended 72% of the time. That didn't actually matter on anything, which was kind of nice. The percent that answered at least once was the same in the control group and the intervention group, and the percent that answered all 3 times was the same, as was the percent tenure track faculty and the percent women in the control group and the experimental group. In terms of the IAT, we did find, just like with science, that about 70% of men and women more strongly linked the male name with the leader words and the female name with the supporter words. And then looking at, we did linear mixed effects models and tried to be as conservative with our analysis as possible. So it's the difference between experimental and control departments compared with difference at baseline. And again, we did an intention to treat analysis, so we included all departments, including those where nobody came. And the IAT was no difference, but I actually think that might be a good thing because it shows you can have an abnormal age or abnormal. You can continue to show implicit bias and still change your behavior. So I thought we would see a change just based on what else was in the literature, but we did not see a significant difference. But we did see significant differences in personal bias awareness, internal motivation to respond without prejudice. My collaborator, Trish Devine, is a social psychologist and has defined 2 types of motivation, internal and external. We found a difference in external motivation to respond without prejudice at 3 months, which we thought was really interesting because the kind of the more evolved motivation would be internal. So like I would say, internal motivation is somebody who would never tell a sexist or racist joke because it's just morally offensive to them. External motivation is somebody who wouldn't tell a racist or sexist joke in front of me, but they might tell one, somewhere else. So you would think that it would be the opposite because internal motivation is sort of the more evolved, but we thought the fact that external motivation went up may have suggested that the norms for behavior, the norms for acceptable behavior in a department might have been changing. So people were externally motivated, to engage in gender equity actions, perhaps. Yeah.
So a quick question, if people take the IAT before being aware of this versus the group that is aware of the associations that are expected, do they score the same? Do you still have, is the implicit bias that strong that even though you're aware of it?
It's really humbling, I'm telling you.
Wow.
I still come out favoring male and leader, and I've been studying it. I am a woman leader. I love women leaders. I can easily have multiple counter stereotype exemplars. We have a woman chancellor. So I was actually kind of pleased to see this because every time I take the damn thing, I come out with a stronger association with male leaders. But I think it shows, these may just be there, but you can recognize when the environment would enhance the likelihood that stereotypes would influence judgment, when you're distracted, when you're in a hurry, and particularly in consequential situations, hiring situations, tenure evaluations, grant evaluations, engage in some of these processes that may mitigate it. But it's hard to get rid of them. Yeah.
Is there any thought about studying the effects of multiple interventions?
Multiple interventions?
Yeah, with time. I mean, so does, how frequently do people have to be exposed to these kinds of interventions?
I would love that,
for
right.
it to basically become a habit and something that they...
Well, 3 months is considered, pretty long term.
Yeah.
But of course, knowing what we know about recidivism and smoking and other things, I would love to have money. The grant's done.
Yeah.
I would love to have money to go back in and do some kind of booster. And actually, we've had some chairs on their own who've asked us if we would come back in and do another workshop, a shorter version. So we're kind of working now on the booster, the booster inoculation. So I don't know beyond 3 months. We will be trying to get money to repeat the study of faculty work life periodically, and we're adding questions about awareness of bias and things like that. But, yeah.
So there's actually an assumption that nobody in the control departments talks to anybody in the treated departments.
Well, when you do a cluster randomized study, there's always the potential for some of that.
So do you have, did you look at, for example, associations between people in departments that were in the 2 groups?
No, we do have people who have joint appointments, and we just ask them to pick a department for the purpose when they filled out their baseline survey, they had to pick. So there could be some diffusion, and now, of course, the control groups have had it too, so everybody got it. So we hope the whole campus is improved. So we did see significant differences in self-advocacy, both at 3 days and 3 months, which I think is really, I wouldn't believe our findings if we didn't see a change in self-efficacy, because every behavioral change theory has self-efficacy as sort of the cornerstone of behavioral change, and so I was really pleased to see that. Yeah.
This is the difference. What if you look at the absolute value of the control departments? Was there any change in that performance just based on the fact that there was something going on campus?
Oh yeah, if we do baseline adjustment, we see huge differences. So we wanted to take the most conservative way of analyzing. One of my collaborators is a professor in biostatistics. She wrote a book, and she really wanted to make sure that she felt confident with this. So yeah, if we adjust for baseline, we get much bigger differences. So this was really an intention
Let
to
me
treat.
make sure I understand. You saw improvement even in the control departments?
Oh, no,
No,
we don't, no.
You don't
Uh-uh.
see anything there?
No, that's why the adjustment for baseline made it,
Okay.
yeah, I believe that's right.
Wait, you said if you adjusted the baseline, you would sort of get more dramatic results than this graph presents, is that what you said?
Yeah, that is true.
If you adjusted the
Yeah,
baseline.
but here we went,
But I think,
differences between experimental control departments compared with differences at baseline. So it actually,
Right, but
you're
that's-
gonna get beyond my ken here, but.
but that's adjusting the
It
baseline.
is adjusting for baseline.
No, I think
Yeah.
not, right? Because, well, you can talk to Mari, but she
But, I
is
mean,
very much opposed to adjusting for baseline.
What's the
Well,
change of slope, right? It's just a change of
It's
slope.
that-
Yeah, yeah.
but
This
it's-
is a change
it's-
of slope.
The
It's the
bottom.
difference in the difference.
Yeah, the difference
The
of the
difference in the
difference,
difference.
it's a difference of the
Yeah.
difference.
Right.
But
Yeah.
you're taking,
It-
it basically
it's
is
fine.
adjusting.
Is it fine?
It's,
But I'm
it's
telling you,
actually-
so
it actually is a good way to do it.
It is.
It's
Thank
the
you.
most
Yeah,
conservative-
and I- and I
It's the most
think-
conservative way to do it.
That's what she
Change occurred
said.
in the most conservative
Yeah.
statistical.
That's what she
treatment.
said.
I mean, if
Yeah.
I had been
This
your
is controlling the
biostatistician, I would have done
Yeah.
it that way.
There you go, thank you. No, well, she is really, she wrote a book, if any of you know
Yeah.
Mari Pult, I
Yeah.
mean, she is
Yeah.
really tough. And so I wanted to make sure I had someone who was really tough. Yeah, I have a master's in epi, but I admit my ignorance on many things. I can get there conceptually, but I can't do it. But anyway, we did see the self-efficacy difference, and we did not see a difference in action with this evaluation, but that was, we did a sub-analysis for that one. That was the only sub-analysis we did because we felt theoretically we could justify looking at action. And there we did see a significant difference in departments where at least 25% of the faculty attended, which actually kind of makes sense. If you sort of get a big enough dose, you're more likely to see a change. So you might say, well, you know, this is fine. It looks like maybe you can change the habits of faculty with this workshop, but does it really have any impact? Does it have any impact on climate? Does it have any institutional impact? So there we could pull the data from the study of faculty work life. And we pulled the data for the 92 departments that were involved in our workshop study. And there were 671 who responded both times. Overall, the response rate was like 41 and 43%. So we looked at intervention versus control and found that there were significant differences in feeling your research was valued, feeling you were a fit in your department, and feeling comfortable raising personal and family issues in the departments that had participated in the workshop. So we thought that was good. Yeah.
Were there any gender differences in who responded to this survey? Or was it?
So that's a good question. So we adjusted everything for rank and gender. I should have said that. In every round of our faculty survey, and this is actually true in almost every gender climate survey that's been published in any domain, women do respond at a slightly higher rate. So women responded at a slightly higher rate than their representation of faculty, but that was true in everything. It was true in the control group, the experimental group, and in all the work-life surveys. So we seem to be tapping into the same group. And also senior ranks were slightly more likely to respond than junior ranks, and that was true across the board as well. But it looked like both men and women were reporting improvement. So it looked like this intervention benefited both men and women. So we conclude from our study that gender bias appears to respond to interventions that are shown to be effective in breaking other behavioral habits, that when STEM faculty break the bias habit, it does appear to improve department climate for all faculty. And although we had to focus on gender for the RO1, we have no reason to believe that a similar approach would not also work in the context of race or disability. So I think that's it. Yep. Questions?
The preceding program is copyrighted by Emory University.